Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about what's included in a complete oral examination.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn, and we're here with Dr. Chuck. It's Your Filthy Mouth, where we're specifically going to talk about what it takes to get a complete, true, legitimate dental exam.
Right.
But before we jump into that, let's remind you, would you please subscribe, whether you're listening on a podcast channel or YouTube? We don't want you to miss any episodes. It's really important, so thank you. All right, so a true best dental exam, what does it take?
Well, first of all, you're not going to get a dental exam in 10 minutes. It all depends on the type of exam you're going to have. Now, with insurance companies and with dental offices, you've got different types of exam. You may have a limited examination where you've come in with an emergency. You've got one broken tooth, you need to get that thing taken care of. You've got a toothache, you want to get that taken care of. That's a limited exam. Usually on that, you'll have a visual exam. You may have an x-ray, a radiograph of that area, but it's very limited on that, which is very different from a comprehensive exam.
Okay, so we're driving down the road, we see, free initial exam or $25 exam. Should that be kind of a flag to us, or is that not a big deal?
I can't answer for other dentists, but let's talk about what's included in a complete examination, and let's see if that could possibly be free.
Okay.
Okay?
All right.
So when you're doing an examination, and pilots, when they fly an airplane, they have a checklist.
Okay.
And because they don't want to forget anything, even though they've done the same flight 1,000 times, you
Right.
want to have a checklist. We've got a checklist. So let's go through the checklist and see what's included in a complete examination.
Okay.
So the first thing you do is you got to review the patient's medical and dental history. Let's see what's going on. What were your experiences with dentists in the past? What are your medical conditions going on? Are you diabetic? Do you have cardiovascular disease? Is there Alzheimer's in the family? Was this all these information so we can see what's going on in your particular situation? So you've got to review the medical history, you've got to review the dental history and see what's going on.
Okay.
So that's before you even look inside the mouth.
Wow.
Yeah. So let's start getting our data collection at that point. Then you have to do whatever necessary radiographs there are. Sometimes you have to take some close-ups. With digital x-rays we have these days, when I was in dental school, they came out with a new film called Ultra Speed, which used 1/10 of the radiation of the regular film. Now they came up with digital x-rays, which use 1/10 of the Ultra Speed film.
Oh, wow.
So,
So less radiation, but better pictures?
Absolutely.
Yeah.
Way less. Plus, now you can send the radiographs, you can email them to specialists. So you don't have to always take them over and over and over again. Sometimes you can share these quite easily now. Whereas the other ones you have to mail, and maybe they weren't the way you wanted them. But
Right.
so you have to have the proper radiographs. You got the close-ups, maybe a panoramic that goes all the way around. That shows the jaw joint, shows what's going on. Now many offices have CBCTs or CT scan where you can see what's going on with the jaw joint, the airway. You can do all of this. And again, they've increased the efficiency of the radiation to where you have so much less than what you used to.
So not a big concern.
Not really. Not these days. Now, if you're having it every week, that's not okay, but this is something you might take every 5 years. So on the CBCT, unless you've got something going on.
Okay.
So you got the radiographs on there. Now you have to have a periodontal examination where you go in there and you check the gums. I was taught this in dental school back in the 70s, is that you go around the pockets of each one of the teeth and you measure how deep the pockets are. You do 6 measurements, 3 on the cheek side, 3 on the tongue side. Anything over 3 millimeters is a sign of gum disease.
Okay.
Anytime you have bleeding, that's a sign of gum disease. So you're actually doing 6 measurements on every tooth all the way around. That's part of a complete dental examination. So make sure you're getting that done, because if gum disease is the source of so many of the problems we have going in our body, let's find out if you have it or not, because remember, there's no pain.
It sounds like we've got a lot going on already, and we're not even, halfway through?
No,
What's
we got
the
ways to
next
go.
one?
So we do the gum tooth by tooth evaluation, where we actually look at each tooth all the way around. Now, when I was in dental school, we used the Sharp Explorer, and you pushed it into the tooth, and if it stuck, it was a cavity. And if it
Okay.
didn't stick, it was not a cavity. Well, we've come a long ways. Now we have some laser cavity detectors. One is called Diagnodent.
It's the magic wand.
Yeah,
Is that
yeah.
the one that goes beep?
That's it.
And it looks, it does it beep when it seems like there's potential for a cavity to be there?
Right. It measures what it does is it shoots a low intensity laser into the tooth and measures the wavelength that's reflected back at it. It can tell whether something is decay, whether it's stained. This has saved me from doing fillings on teeth that I thought was a cavity, but it turned out to be stained. But it's also helped me find cavities that I would have missed otherwise. One of the first examples was my daughter. She was one of the first people that I used this machine on. And it said she had a cavity on her tooth. I would have bet you money there was not a cavity. It's like, oh my gosh, I spent thousands of dollars, bought this equipment, and now
It doesn't work.
I don't trust it.
Right.
So it was my daughter. So I numbed her up.
Because that's what you do with family. You use them as experiments, yeah.
And I made just the tiniest hole in the chewing surface. And I looked down in there, and son of a gun, there was decay there.
No kidding.
And so I was able to get it and take care of it. And that machine has not been wrong yet. So I trust that. But you got to know how to use it, just like any piece of equipment.
Sure.
So you look at the teeth for any areas of decay that might be going on there. So you've got to look for, you're looking at the gums.
Okay.
You're looking at the teeth. Looking at the jaw joint, got to figure out, is the jaw joint working? Do you have popping? Do you have clicking? Is it uncomfortable? What's going on with the jaw joint?
This is all standard. This should
standard.
be a standard exam.
Well, this is for a comprehensive dental examination.
Okay.
You have limited exam and you have comprehensive exam. So make sure that when you're getting this exam, you know which one you're getting, because you can't make life decisions on a limited exam.
Right.
But you can make life decisions on a comprehensive exam.
I'm guessing the comprehensive is not going to be that free or $25 exam. That's going to be a...
It's going to take a little bit,
Open close.
It shouldn't be.
Yeah.
It shouldn't be $1,000. I mean,
Right.
it should be way less than that. But I mean, you've got to be thorough if you want to uncover what could be going on. So they also do an oral cancer examination and see is there any type of cancer. Now we have special lights that you can look in that show where the cells are multiplying faster than the cells around them. So if it's early malignancy, now maybe you can find it. We don't know how to prevent oral cancer. So the next best thing is early detection, and that's what this will help you do. Another thing we'll do, and it depends on the patient, but sometimes you can do saliva testing, where you actually take some of the saliva, or you actually go down in some of the gum pockets, and you send this away to a laboratory that tells you what bacteria do you have in your mouth and what concentrations of that bacteria do you have in your mouth. Many times now they can come up with some oral antibiotic rinses that you can rinse in your mouth. You don't swallow it, and it'll kill the harmful bacteria in your mouth. And that
Wow.
can be done in a short time. That, in addition with some dental care, can get your mouth healthy in much less time. But now you know exactly what you're fighting. That's why the saliva testing is such a good idea. Airway evaluation. Are you able to breathe in there? These are all included in a comprehensive examination.
Yeah, breathing's kind of important. It's
Yeah.
really not overrated, right?
Just because you wake up and, did I sleep good last night?
Yeah.
I don't know. I feel. Well, why? Did you get a good night's sleep or not? And so one of the things you want to do is be able to at least identify people that might be suffering from sleep disordered breathing, and then help them maybe figure out whether they have a situation or not. And there are ways you can do that. We have to check the bite. Because if the bite is off, that can cause popping or clicking of the jaw joint. It causes headaches, can cause neck aches. A lot of the gears have to mesh. If the gears don't mesh right, well, what happens? You're going to have something's going to break.
Sure.
And that's what happens in the mouth as well. One of the things that I think needs to be done is when all of this information is gathered, all of it needs to be gone over with the patient or the patient and their family or the patient's significant other, so you can understand what's going on inside that. So you've got to review all of the information with that patient. That should be included in a comprehensive exam. Sometimes they'll do it on the same visit. Other times they'll want to digest this information and do it on a second visit. But at some point you need to sit down with the dentist and go over all of the information they found. The next thing, I think, is for the dentist to give you options for what you have going on. When I look at the highway, not everyone's driving a Cadillac.
Right.
Okay? Everyone needs transportation, but not everyone's driving the Cadillac.
Right.
So let's see what's going on in your situation. What are the choices? Number one, you want to be disease-free. You want to be healthy. But as far as replacing missing teeth, as far as the options, you've got choices. There are
It's
many
not a
different-
one size fits all. It's not going to work for everybody.
No, it's
right?
in your situation, what's the best in your particular situation. But you need to be made aware of what your options are. That's important. And the last thing on this is that I feel the dentist needs to inform the patient's physician about what's going on. So if you find a lot of gum disease, if you find dental infections, if you find airway restrictions, if you see the bites way off and there's popping and clicking, you've got to tell their physician, because the physician has no idea. And they're making medical decisions based on limited information if they don't know what's going on inside the mouth.
So maybe the patient's going to a chiropractor for, neck issues or something, but it's really because the bite is off. I mean, it's all connected.
That's all very possible.
Yeah.
Yeah, the toe bone's connected to the foot bone. The foot bone's connected. I mean, we are so interconnected. We can't just take one piece and say, well, that's just this.
Right. Interesting.
And I'm afraid that's kind of what's happened sometimes in our medical world is this one covers the heart, this one covers the GI, this one covers the bone. Well, at some point, we need to all work together. And that's why those of us that cover the mouth need to make sure we get our information, especially the primary care, but also the other specialists. They need to know what's going on inside the patient's body.
All right. Well, hang on just a minute. We've got a question of the week from Jim this week.
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck, this is Jim. There's all kinds of different toothpastes out there and fluoride and whitening and things like that. Is there any kind of toothpaste you recommend?
Good question, Jim. Is there one toothpaste that's better than another? I'm kind of general in the way I look at these things. I look at the big picture. I'm not hung up on technique. I'm hung up on results. There are some toothpastes that are a little bit more damaging. If you look at some of these really abrasive toothpastes, they can notch your teeth really bad. If you look at some of the whitening and tartar-controlled toothpaste, they can create sensitivity on a lot of people. So you got to be careful on those particular toothpastes. But whatever toothpaste you're using, you want to make sure it's being effective. And one of the things you can do, and this I'm getting back on my soapbox with disclosing tablets. This is the way you check yourself. No matter what toothpaste that you're using, clean your mouth as good as you can, chew up one of those pills, and take a look inside and see where you missed. If you're getting better with one toothpaste than another, use that toothpaste. So again, I'm not hung up on the technique. I'm really hung up on the results. So use whatever toothpaste is going to work in your particular mouth, but remember, you've got to get them clean. However you do it, you've got to get them clean.
Okay, so this week we talked about what it takes to have a really good dental exam. And Dr. Chuck, what would you say the takeaway is?
Well, first of all, you have to remember there's a difference between a limited examination and a comprehensive examination. A limited examination just looks at one area of the mouth. Comprehensive looks at all the teeth, the gums, the bite, the airway. There's a lot of things taking place with that comprehensive examination. So that way, once you have more information, you can make better decisions.
All right, and be sure to check out the show notes within this program, and be sure to hit the subscribe button no matter how you're listening or you're watching on YouTube. We really appreciate that. And most importantly is to share the information with family and friends, right?
That's the whole idea, is if we can get your family and friends, no matter where they live, this isn't about Central Florida, this is about wherever you live. If you can get your family and friends to understand how important a healthy mouth is, and maybe you can help them prevent some other, not just expenses, but some other medical issues, wouldn't that be great? So we want to share the information.
All right, and if you've got questions for Dr. Chuck, just go to yourfilthymouth.com. You'll find all kinds of good information there.
Yeah.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.